Wonderful. Got it. So, welcome everybody. So thrilled for all of you to join us. I'll quickly introduce our panelists for today who are going to talk about the mind of an entrepreneur. How do we think like an entrepreneur? So it's not about, are we going to start a business? Or are we not going to start a business? But whatever we are doing, can we think about it in a more entrepreneurial way? That's what we are going to explore today. We have Feroza Engineer. She is a very renowned coach and a leadership development expert and a powerhouse facilitator. What I love about it is we have panelists from across the country. Feroza is coming to us out of Mumbai, where it's raining outside. I would like to then welcome Bhavna Yadav. She is a young entrepreneur by her own. She says she's young, and the enterprise is also young, and it's a very interesting background. And we'll explore this even more about how the background does or does not impact the business you start. And it's very interesting because Bhavna is a lawyer. She's highly qualified in multiple fields and has many degrees. So, but this is really, she's almost straight out of college and running her own business with a co-founder. She's a founder and she has a co-founder. We then have Rama Rajasekaran, at the other end of the spectrum, highly experienced director of the Ganga Medical Center and Hospitals, which they have their own hospitals, they have their trauma center, highly specialized in spinal injuries, very niche and specific about what they are doing. And she has continuously qualified herself to run these hospitals. So family business, but run completely by professionals, including Rama, who's highly qualified. She has an MPhil in hospital administration, and she's an NBHS assessor. So that means she really knows what goes into making a really high quality hospital. So we have panelists who cover the whole spectrum of, looking at enterprises from the newest to highly experienced and successful entrepreneurs. And we have Feroza, who will also do, represent all of us coaches in here as we run this for the National Coaching Council, this panel. It's the third of the series, and we are thrilled, and we are ready for the next one, which Samya will moderate around finance. And she'll talk a moment about it just before we leave. So I would like to jump right in. And when we think about the mindset of an entrepreneur, one of the first questions which comes to my mind is, what inspires people to start a business? So I'm going to ask Bhavna that question. And like I was referring in the introduction, Bhavna, does your education, your work experience, your background, your family background, does all that affect the business you start, the kind of business you start, and how you run it?
Hello, ma'am. First of all, I'm honored to be here. And being a very new entrepreneur, I am beyond thrilled to share my experiences. And coming straight to the question, I think I come from a very different background. I come from a service sector background. And I don't think it affects your, potential or the ability to run, entrepreneur or a business or a startup, you may say. So I feel there are two important things, and even if you have the skill set or the background, it adds to the thing. But otherwise, in my case, where we are two co-founders, and our company is called Level Up for Women. We run a women's physical health and wellness center that is completely digital. So basically, I am not. I don't have a fitness background at all. I come from a political science, public policy, little bit of law, all these backgrounds. So what I could bring to the table was my skill set of being a leader and logistically holding the ground. Whereas my co-founder had a skill set of being in the fitness industry. So we both merged the things, and that's how we are trying to run our enterprise and making the best out of it. And I am not sure if it's my place to say or not, but I think in terms of coaches, one can definitely make their skill set as their own product. So making themselves as their brand, as Firoza ma'am is doing. So
Hmm.
that's a wonderful way, I guess, to making your skill as your own brand. So
Beautiful.
that's what I would say, that
Yeah.
even if you are from background or not, it doesn't matter. It's you just need to have
Absolutely.
the confidence.
You are the brand. That's what you're saying. So, Feroza,
Exactly.
that's a nice segue into
Yeah.
This
how.
is not what happened in the dry run. I'm just calling out
Come
for
on.
everyone here.
The
Like this,
dry run is for all of us to get to know each other. We are strangers and feel comfortable. Now
I
we just
know,
have a conversation, and
I
Bhavna,
know,
Bhavna
I
is
know.
just, lobbing the ball to you. She says, how do you build your own brand? How do you create opportunities for yourself and your business?
Thank you for that. And I don't think there is a fix answer or there is a fixed template. I just first deeply feel we need to spend time in understanding our uniqueness first, and maybe also having some kind of self awareness that this I cannot do.
Mm.
I cannot do this. From a very genuine intentional place. I'm all about growth mindset, having born and brought up with a lot of anxiety issues and with a culmination of learning disabilities, and I didn't even write my graduate exams, a writer did. So very early in life I had to figure out different ways of learning, and very early in life, like no option, like you don't have an option there, literally. Let's just put it that way. Growing up in a family of engineers, it was decided that you are going to be an engineer. Like it was literally like this is very filmy, but like when I decided to do psychology, like my dad didn't speak to me for 6 months, being in the same household. It's like ridiculous. Like that never happens. So when you talk about opportunities, some way the child in me, the adult in me, is always about like I have to create them. Somewhere something has to happen, and I only have to do it.
Yes.
Like somewhere, and I feel the most basic way of doing that is just showing up. Like, are you showing up in a town hall? Are you showing up in a conversation? Are you showing up at lunch? Are you showing up in a meeting? Are you bringing your whole self, or whatever your sense of self is, whatever it is? Are you just showing up to see that, okay, can I add value here? Okay, or maybe I can do this.
Mm.
And that's why recently, and it's very true to currently where I'm going, because
Mm.
I don't know. When people ask me like a 5 year roadmap, I'm like, no,
Yeah.
but I know what I'm doing in the next 5 months. Or so just
Beautiful.
showing up. Like I feel,
Absolutely.
just show
You
up.
know, what I'm hearing you say is you're creating your journey, you're creating your path as you walk on it. And that's, I think, true of almost all entrepreneurs. It's very rare for entrepreneurs to have all the answers when they start. Many times, that question of are you doing this? We don't have an answer. We know we have to do it, and we figure out that answer down the line, and then because people ask us, otherwise we don't even need to figure it out. We know we want to do this, and we go ahead and do this. That's a very entrepreneurial mindset. So I'm hearing you say, know your strengths and build on your strengths and keep building on your strengths. And that's so beautiful. I'm going to go back to Bhavna for 1 second to ask, Bhavna, is there a personal reason why you got into this particular business?
Yes, definitely. So I feel most of the entrepreneurial journey start from somewhere personal experience, and so our niche is dealing with PCOS, and so that's how I started. I was actually out of college. I was actually preparing for civil services. out of my choice. And then the uncertainty of exam and the stress building around it led me to my irregular cycle, and which led me to clinical depression. So I was going to various gynecologists trying to find solutions and answers to my questions, which I was not getting anywhere, to be honest. And I was only led towards one side of the story, which is medicine side, which I truly respect, because it is a boon for us in many ways. But I needed, since PCOS is a lifestyle disorder, it's not a disease. So I needed a holistic answer, which I was not getting anywhere. Then my co-founder, my partner, he comes from the fitness industry, and with his expertise and solutions, we applied this four pillared strategy, and then our brand was born. But it was not born as only PCOS. It was started as a general women's wellness brand. So we wanted to help women which were not finding solution anywhere.
So is your focus a broad-based customer base, or is it very niche now?
Actually, when we started, we wanted to explore the industry with a very broad mindset. But when we explored and did our research, we did complete market research and understood that if we have to survive in the long run, we have to make sure that we hold our ground. And we did our research. The data told us that there are not many companies in India which are focusing solely on the PCOS problem.
Wonderful.
So that's how we narrowed it down, and we are completely dealing with only one thing.
Wonderful. So you went through a very structured exercise to understand customer, which I would like to, bring Rama in here. And Rama, because your organizations are already very large and mature, how important is it to continuously scan the industry environment, understand where the patients are coming from, and what are the changes which are happening there in your industry?
Really, it's nice to see all of you, and in fact, it's quite new to me. And I'm glad that you had invited me to talk and at least share my experience. That's what I will say. And as you said, we, of course, we felt that as an organization which has been here for a long time, we have our main four pillars, which I call it as my pillars. One is our clinical expertise, because we have a gamut of experienced doctors in this subspecialty of orthopedics, plastics, and we have academics. We are doing very well because we conduct a lot of meetings, research, and finally social responsibilities. So these are my four main pillars which my whole institute, my hospital stands on. So this is it covers everything. So when I talk about we try to scale on this, which is where our values fall into place. And being already an organization, we had to keep growing. It's like nice to know, Bhavna, like this is startup and you have a lot of cool and ideas, but here we have to grow from this level to the next level. So that was a bit of a challenge. But only thing I think I'm very proud is everybody, being it's a private family organization, but all of us work with a lot of passion. We have set values, and because for us we try to provide the best quality service for the patients, and patients nowadays are very demanding. They're not like those days, okay, you go to one physician and whatever he says, it's like God's gospel truth. Today they come in with all these net downloaded, and how do you do this, how do you do that. Every physician goes through this. So that was a bit of a for us to think. But we've always focused on our four main pillars and our values, and we try to give the patient the best and affordable cost. That was one of the reasons how we to
Okay.
come and
So quality and cost,
yes,
which
yes,
is like a
quality.
given. And how do you keep the patients coming back? Your credibility, your what
In fact,
attracts them?
we don't have like a marketing department at all. It is just I think my patients are real ambassadors who keep bringing back new patients. And as I told you, we take up like any emergencies comes, which is not very popular those days. Any emergencies, as a policy, we don't charge them at all. We just take up the patients, do all the even if like mostly we get very smashed, with the road traffic accidents happening. People come with in a bad state. The senior most consultants are available 24 hours round the clock. That gives a confidence, but and they try to just revive the patient, put them back. By then the family arrives. So we never, that had raised the people's value, like the customers. I'm talking about the patients.
Yes,
They felt, oh, you go there, you become
yes,
okay.
yes.
That was
So,
like a
and this is exactly the opposite of what happens in most hospitals when there's a road accident case.
yes, yes.
They have to
They say
involve the
immediately go to
police.
the government hospital.
Yes,
But we
yes,
took it up as a challenge, and that's how most of our we built
that's
up. And even today, for our outpatients, we never charge them, and because some of them go free and all that.
yes,
So after the doctor sees, then only they pay the consultation fees.
beautiful.
It's not
You know,
collected before.
wonderful.
That's one
So
of
you completely identified a very important gap
yes. We had
in
tried to
your
create a niche
space,
for
and
ourselves.
wonderful, wonderful. And Feroza, when we look at coaching, like, Rama is able to tell us so clearly that this was
Mm,
a gap, we bridged that gap.
mm,
When we think about coaching as coaches and then
mm,
building a business around coaching,
mm.
is it just about building a coaching business, or are there other allied skills that we tap into, we build? How do you see this?
Yeah, yeah. And maybe I'd like to address that with really working first on your foundational skills. I always have budding entrepreneur coaches or people who want to start these boutique coaching organizations always ask me, oh, which certification should I go for? Should I do this course? Should I do that? Should I blah, 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 blah?" I'm like, first be out there. Which problems have you solved for? What kind of people have you met? Have you been just so fussy and picky, choosy about the things or the problems you want to solve, whether it's as a mentor or a coach or a counselor? Be open, because eventually you will realize, okay, here are the things maybe is I'm good at. Can I sharpen that saw?
Mm,
Versus trying to do boil the ocean. And that's when, it's like saying you will realize what your niche is when you start being excellent at one thing. And you will be excellent at one thing once you narrow down what your niche is. But uske liye you will have to thoda be out there in the field and then discover that, okay, maybe I can write as well, or
mhm,
maybe I can consult as well,
mhm,
or maybe I can teach. You will figure that out, but giving yourself a holistic chance first,
mhm, mhm.
and then trying different things versus just getting up one day and I would say just carpet bombing your skills. Like, have you met some coaches who do like 500 things? Like, I'm just saying, because it's like, how deep also have you gone with a certain, and maybe then you will call yourself a career coach or a
Mm,
transitions coach or a
mm,
bereavement coach or a performance coach or a life coach or I mean, there are so many
right,
different types.
right. I'm hearing across the board, all three of you saying, focus, focus, don't spread yourself. And you are
Yeah,
saying it from experience. You started and you figured out that focus works. And
yeah.
the deeper the focus, the more easy it is
And you will
for.
get there, and you will get there, and you might, and I'll tell you this the second thing is just get rid of the stubbornness or this, I'm only going to do this. That's how I actually assumed I started. I was like, I'm only going to coach on weekends and that's it, and see where, because I was impacting job. There was pandemic. I had planned a sabbatical. I had paid visas, tickets, everything. Family was traveling. So I was like, wow. And here we are. Like literally marinated for 2 weeks, cried, thought of what is going to happen, how's going to income come from, where, blah. And then literally one fine day, I'm like, why am I doing this now? Because I'm doing this. Let's just do this and let's just see where it goes. And then can't be picky, choosy, but then be open to things that are coming your way.
Right. So, which brings, at least in the coaching business, it seems to be a very important question. Our identity as a coach, we have a perception about ourselves. How do we deal with the way we look at ourselves, the values we hold, how we think coaching should be done, and the reality of doing business out there? Do they align? Do they go well together? Or are there some adjustments we have to make?
I think a bit of both, because as many certifications you get, as many coaching classes you do, you will have your own individualistic coaching style. Just like you would have a teaching style, a managerial style, a leadership style, a motherly style or a fatherly style.
Yes.
We will all have that differently. Um, but for us to get there, are
Mm,
you being open about what coaching as a field could create for you? You might begin to understand that you're becoming a better listener or a better facilitator or a better problem solver. And you might want to you might, that's what I'm saying. You might start opening your mind to, okay, what is my business about? Am I group coaching? Am I individually coaching? Am I doing large group workshops? Like, what is it?
mm,
But have I still been open to witnessing or studying or trying or maybe just seeing how that feels
mm, mm.
and then taking those steps, because there is so much out there which is good, and yet some of it is misunderstood, because there are a dime and dozen coaches and you become a coach after a 3-day retreat in
Right.
Ambi Valley. It is
Mm.
so ridiculous. So, you know,
Right. So it's bringing us back to let's focus and create a very clear image in the mind of our customer, potential client, patient, that this is who we are, this is what we do. When this happens, you can always come to us, and we are the people, the people. And Bhavna said that we are the people to come for when it comes to PCOS and well-being. Um, how has the fact that you're a tech company helped your business, Bhavna?
Ma'am, it has helped us immensely because in the globalization world, we have to understand that, as Rama ma'am said, that net is affecting our thinking, and it definitely is. So even when clients come to us, that they we have to assume that they are coming to us as a last resort, because they have tried multiple things. They have been to traditional set of treatment, to gynecologists, to other brands that might be doing the same thing, or to everything. So when we set up our company and we decided that we want to take it global, because PCOS is not a geographic issue, right? It's a global issue. So currently we have clients from US, Dubai, all over India, and our team also sits in the everywhere in the country.
Mm,
So our dietitian is from Mumbai, our doctors sit in Pune, I
mm,
sit in Gurgaon, my co-founders sit in Chandigarh,
mm.
and our exercise trainer and yoga instructors are Jaipur, everywhere. So
Wonderful.
basically, I think that's how we connect.
Mm,
We were initially apprehensive how we will be able to manage it, but it because internet and the world has this connectivity has made it really easy to focus on one brand and make it easy for us to connect. So even today when we are connecting with our clients in US, it's not it doesn't seem seven seas away. It seems
Yeah.
it's just one tap away, right?
Yeah, exactly.
So yeah,
Like all of us
technology,
right now.
yeah, technology has actually changed the game a lot.
It's just made it so much bigger and better for you.
Yes, it
Wonderful.
many
Right,
doors have been opened up
right.
because of that.
Wonderful.
Yeah.
That's beautiful to hear. Rama, how is technology being adopted for growth in your hospitals?
See, usually now, if you take any industry, if they want to grow, I'm talking about the industry. So what do? They bring in more new machines or anything, and they cut down on the manpower.
Hmm,
But hospital, it's so different.
hmm,
Healthcare, I mean, any healthcare, because there are certain norms like you have an ICU, you have to have 1:3 round the clock. So our we focus like our manpower strength is huge from my what do you call housekeeper grade 4 people to the consultant. So
hmm,
I need everybody there, and patients are very demanding. It's not like in those times they will adjust. They want when they at the click of a button, they want everybody to be around them.
hmm,
So it's so though we have adopted all these latest technology like machines and all that, we need the manpower is it's something which we cannot compromise. Even if you
hmm,
look at NHS in UK, it's that's supposed to be one of the highest number of employees are there because so though we have technology, any entrepreneur who's looking in to start something on health, I mean one to one, not like in Bhavna is really nice to have a people linked everywhere. But now patients are linked with all their knowledges. They come in and say, they try to share it with us, and what do you say? Or they have as the sometimes a physician talks, they have their son coming in from US to say, come on,
hmm.
why can't you do this latest one which is happening in the US? And
Absolutely. And
uh,
they'll all have some doctor in their house, in their
yeah.
family.
Everybody, or they make sure they know somebody. So,
Yeah.
all these, though technology is important, we as an institution have really upgraded. And of course, we nowadays we're doing robotic surgery. I mean, we're using robot also. And we have all these major, like, see, we call it an O-arm, which is like much higher versions and all that. Still, we have to have the manpower. We
Right.
cannot compromise on that.
Right. You
Because
want the human touch. The patient
yes,
also
yes,
wants the
human touch
human
is
touch.
so important for them. Anybody, I think during COVID times, you'd have felt it, how
Hmm.
important and how very stressful
Hmm.
it was for all the hospital
Hmm.
working workers, health workers. But no, technology is important. We side by side, we have to have the manpower also. So we can never
Right.
compromise. So
Right.
that's one
Right.
thing, and they can't do multitasking much. They can to an extent, but then they need the support. The
Yeah.
support staffs are quite
Very
huge.
important. They are more critical than the doctors a
Yes,
lot of the time.
yes.
Your
My
hospital
nurses and
depends on them.
nurses, they just migrate. I mean, they work
Yeah.
here and after a year or two, they just want to leave.
Hmm.
So, any entrepreneur, when they're looking into that aspect, they have to, give a lot
Hmm.
of importance for manpower.
Hmm. So, quick question, Feroza. A lot of digital platforms have emerged
Mm,
even in the coaching industry.
mm.
And like Bhavna said, it's wonderful for people. Coaches can connect globally, clients can reach out to coaches anywhere. What is your take on this uh, trend?
I think it's natural because people are creating employment,
Mm,
and people are also creating opportunities for partnership,
mm,
and that could lead to brand visibility, that could lead to future employment, right? Yet, if you are able to genuinely figure out a niche area in which you operate, and then if you work on deep assignments with clients, so showing them actual transformation, long-term journeys. I'm not saying all the quick fix 2 month, 3 month assignments are not nice, but can you work on deepening a relationship, because that is actual trust. So whether
mm,
in the medical field, in any of our enabling services, trust is currency.
mm. Very interesting you're saying that, because I think I heard Bhavna say earlier, in an earlier conversation, Bhavna, that 40% of your business is repeat business.
Yes,
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 definitely. Yeah.
yes. And that's true. So if the digital platform helps you amplify your services, what is the objective? So somewhere you also have to start thinking strategically when you're working in a
Mm,
business, even if it is a healthcare enabling services. Like you have to think, okay, bottom line, is my whole team going to be impacted? Like Rama ma'am, like ER. ER
mm,
has to have the finest skill set people. ER team has to have maximum trust, collaboration, communication. Like that team needs that. So that would be their focus area. You know what I mean in
right.
terms of understanding a business. And coaches could do that over a
Yeah.
period of time, strategically knowing. And if digital platforms give you the opportunity to amplify your services,
Mhm.
great.
So it goes back to what you were saying earlier, get there, be seen, be
Just
visible.
try. Just, I mean,
Mm,
like before giving up, or,
right,
just
right,
maybe.
right. So I have two options. I want to quickly ask all of you, what is a high for you as an entrepreneur, and what are the important habits which you have, adopted to deal with the highs and lows as you go about building your businesses?
I think if you call us highs, I mean for being in the healthcare, I think the patient satisfaction or the patient's response, as Feroza said, the trust is very very important. They have to trust you,
Mm.
and that gives you a confidence. And lows, of course, when we get all the lows, starts you down. But it's always a
Right.
challenge. But it's very gratifying and done.
Yeah. And
That
what habits would you share? What are the kind of habits, entrepreneurial mindsets, which you
Yeah, mine's. I think your vision, and you should have a passion, a drive towards it, because you will have ups and downs. It's not smooth, but only if you have that urge to come on. We have
mm,
to how to tackle any issues, any
mm,
problems,
mm,
or any grievances. How are you going to do it? Sometimes
mm,
that gives you a lot of.
yeah, yeah. Never giving up on the problem solving.
Yeah, never. Yeah, try to take it up and take it up as a challenge.
Yeah, yeah.
That gives you a lot of strength.
Right, right. Bhavna, what
I
are the good
completely
habits?
agree with, we are in sync with this. In our line also, whenever the client comes with a, even slightest result, and they are positive, they feel that, somewhere we've helped them in the journey. So it's a definitely a high for us, and it motivates us to, give the best service ever. So that's why we also focus on personalized service a lot. So I, from diet plan to exercise, everything is personalized, and when it works, it's definitely a high. But
Mm,
again, the low is when we have to push our clients to be motivated, and it's a long journey. So the long journey really scares people, which it should not. So actually, so that's why the to make the process easy, we keep reminding ourselves as a team, why we started it and what's our vision, again, as ma'am said. And it keeps us going. Whenever we see a new consultation coming up with and saying that they've been suffering since 10 years from PCOS, it's a new challenge for us. And it's a, it's somewhere, it more than profitability, it comes as a responsibility that we have to help them. And
mm,
definitely, as I said earlier, that they come to us as a last resort. So we have to, put our best team front and do our best. So that's the motivation, I guess.
mm. Feroza, what personal habits strengthen you as a coach, which all of us can take away?
But
You
can I
talked
tell you
about.
my highs and lows first?
Yes, of course.
No, because like I wrote it down while you all
Yeah,
were talking. I'm like,
yeah.
I'm glad I'm going third. All
Mm,
right. I think the highs for me have always been like, genuinely just sitting back and connecting the dots.
mm,
Like just going like, oh, that's why that conversation there got me this. Acha. Or oh, this one is from this one. Acha. Samya
mm.
reached out because Pragati. Oh, because how did I meet Pragati? Because oh, like I'm like, wow, I know everything is connected. Like maybe I appreciate that belief in life. I don't take things for granted, or I'm like very sometimes that's also something that I need to work on. But I'm like, I think everything is connected. So connecting the dots is literally my high later. Um, I think lows is something all of us will here resonate with. I hope we are listening right now. This entire chatter around compassion fatigue. As teachers, as enablers, as people out there in the field, mental health, coaches, you can get fatigued and tired with that many
Yeah,
conversations. There
yeah.
is little that of you can be everywhere all the time, you know. So just being mindful of that, and maybe that's why more than habits, I think these need to be lifestyle changes. I know I'm making these very righteous statements,
No, no,
but like I
typical.
feel if I can do this, if somebody's so like if you know me, you know me. If I could do this, I think anybody can. So maybe just three things. I've just over a period of time learned to manage my energy and my anxiety. Like this is a gift. I can't do anything about it if I'm standing 24/7, and that's all right. I need to manage this. I need to write stuff down, or maybe color code certain things so that I
Mm,
can remember better. Fine.
mm,
Second, I think I need to take care of my people. I have a small team of 8. They've been with me through and through. And then that's it, like, and three, I really feel we have to work on our craft. Coaching is not like again, it's not like some bulletproof plan that you have. It's as much as an art as much as it is a science. So are you honing that? Are you
mm,
regularly updating? I
mm.
think that's the clincher because uh, like as a coach, do you have coaches? I hope
Yeah,
you do. You know
yeah,
what I mean? Like that
yeah,
circle of
yeah. And
yeah.
I always say coach every day.
Yeah, yeah.
Coach every day.
Um, I have two questions. Okay, I'll take them.
1 minute. We also have a lot of questions from the
Yeah,
audience. So, Feroza, shall we take some of those
yeah,
questions and then don't forget your questions? We'll we'll
yeah,
we'll end with your questions.
yeah,
So, Varsha, do you want to help us by saying, kind of looking at the questions
yeah,
and
yeah. I don't mind. I've read. I'll go ahead with it. Are you okay with that, Varsha?
of course, go ahead. Ankita had a
Cool.
question for you, and
Cool.
thereafter,
Samya did. Samya's
mm,
question is, and for the benefit of everyone, as a coach, the battle is whether to go as a solopreneur or join hands with others. Please, views, please. And I think all of us could take this. Um, I think the question, hopefully, maybe you need to ask yourself is, what will it take for me to start either? And then genuinely see where it goes, giving yourself that little chance. Like instead of this, just rephrase this question in your head: what will it take for me to start with whatever it is, like really, whatever that is, and then just see.
mm,
You will literally either come to the answer, because I really don't believe in this BS that I keep hearing all the time. I'm not doing this because I don't have clarity. I'm like, clarity is not some meal or some gift or some item or some object that somewhere you're going to buy and you're going to get clarity. Only when you do something, say something, don't do something, you will get
yes,
clarity. Like,
yes,
aage badho. So that's my view. Bhav,
yes. Keep
yeah,
engaging, and as you keep stay in there, akhade mein, and clarity will emerge.
true.
Otherwise, it's not going to. First, the confusions emerge, and then the clarity emerges. Otherwise,
Confusions are
where
the
does it?
way of life.
Yes. Is there another question there already?
Ankita's question is, as you are building your online brand, how do you deal with social media detractors, anti-stories? How do you build your voice over the noise? By just not listening to the noise. Sometimes Because there's lots of nonsense. Really, in my LinkedIn, I should show you my DMs. It's full of BS, like really loud BS.
Mm.
So sometimes just ignoring that. And I've always felt like I don't understand that why should you have separate social media strategies, LinkedIn, Instagram, Facebook, all of that should be separate. Firoza, even your WhatsApp. I'm like, no, sorry, I can't deal with it. I am who I am on all platforms. I
Yes.
said, I cannot do this nonsense of this is here, this is there. So maybe sometimes just that zid that no, I cannot do.
Mm.
I will do this. This is all I
Right.
can do.
Right.
That's
I'm
it.
going to throw that question open to Bhavna also, millennial, definitely. Bhavna, do you have a social media strategy for yourself personally, for your business? How does that work?
Actually, we do. We again, but it's not something something to be taught. It's as who we are. We are truly representing our passion. So we try to. When we started, we thought we'll not limit ourselves just to the transactional courses and all that. We thought we'll educate our audience the most. So PCOS is something which is not very well spoken of. It's still stereotypical, and so that's why we took both our LinkedIn and Instagram, Facebook, everything we took our platforms, and we threw open to the audience to educate them. So we hear all types of, as Firoza said, BS everywhere, but because since it's a sensitive issue for women, and when we are putting content out there, some men are definitely putting lewd comments, which are not worth the negotiation. So that's why we also try to again refocus our passion, and try to completely focus on our vision to educate and to transform people. That's our vision, to heal the people, and that's how that's the marketing strategy. When we are
Mm.
educating our clients, we are educating everybody, and that's how we get our clients also. They
Mm.
believe we have some information, they believe we have some
Mm.
insights into the world, and their
Mm.
trust brings them to us.
Mm.
So yeah.
Which is also partially an answer to Karuna's question, which she's just raised. And I'm going to pass that question to Rama first and then Feroza. Rama, though it's very clear that when accidents happen, people come to you. And yet for you to keep that hospital a sustainable, growing business, what other ways do you need to adopt to keep the clients coming in? How do you reach out to them? You're muted, Rama. Sorry.
That's a good question. What thing is, see, we try to bring in a holistic picture. Anybody who's doing like any, I mean, that's one of my take home messages, because we don't see only high end patients. Like we have all categories of patients. In fact, 35% of our 650 beds is for general wards, and out of which so many just go free.
Mm.
And we do a lot of social responsibilities, community programs. We have camps, assisting in, we do on, we have a mammogram machines. We try to be one of the first and a few. Like, in fact, we do a lot of road safety programs, seeing the number of accidents. So the people have gained a lot of confidence in us. Okay, come on,
Mm.
you
Mm.
can go up to them and they are there.
Mm.
And also, what was the second part of your question?
How do you bring them in,
Bring them in. See, because we have, as I told you, we do a lot of academics also, and that has attracted a lot of doctors from other side who come. We have, I think, one of the first ones in India to have started live surgeries. We
Mm.
show them live surgeries, how to learn. That was never done. Usually it'll be like a talk. But this
Mm.
they see. So that attracted. In fact, we had a meeting of nearly 700 people had come, which is a huge
Wonderful.
number for us. and that was a big challenge. But that was something which every time, I mean, and of course, media comes to know about it, or by the word of mouth, so they come to know. And the
Mm,
social responsibilities, like we have a special mammogram bus, I mean, like
mm.
with the
Yeah,
mammogram center, which moves around, identifying patient, and where whoever is a patient or needs some special care, we do it totally free.
wonderful.
So we look it out, yeah, and like that now recently with the government, they identify like, more than 25, 30 children who
Mm.
needed some correction surgeries, which was done totally free of cost.
So what
So
I'm hearing
how
you
do we
say,
manage
mm,
as I mean, like, we have a set of like paying patients of the high who are that also compromises for this, or like Rotary, or some other
mm,
people do it as a CSR project.
so
So that
multiple
way,
channels, many,
multiple
many channels.
channels we get in. Otherwise, it's very difficult to.
Yes, yes. And we do the same. Wiki itself is like, a place
Yeah.
where coaches get together, like you got all your doctors around the operation table.
Yeah. We
Yeah.
always, and also one of my thing is most of my doctors, I mean, or all my senior staffs have literally, because retaining people is a very
Mm,
major issue for
mm,
us.
mm.
In any, not really nurses. So in fact, most of my doctors have been here for more than 15, 20 years. I literally grew up with the institution. So
So
our ideas have also gone into them. So
wonderful. So
they
first you keep your
also,
doctors, then you keep your patients.
yes.
Which really also links to what Feroza was saying about allied activities.
Allied
So,
activity.
yeah. So, Feroza, what is your take on that
Um,
question?
can I answer Karuna's question,
Yes, yes.
please?
This is Karuna's question.
So Karuna has asked, what are the best ways to generate leads for your coaching business? Um, Again, if we have to think from a business perspective, maybe we could approach it slightly differently.
Mhm.
And I'll try and help us understand this with another parallel example. Let's say one of our friends wants to be a chef or wants to open their restaurant. We're always seeing them making something, serving us, or trying it out, or this or that, or putting in their money, or studying, or being out there. Now think of coaching. Coach, no, help, no. Even sometimes if it's pro bono, if it's purposeful, if it's meaningful, because you are building trust, you're not building a lead, you're not building a client. That will happen later. Think about that chef friend also. Now that's what they are doing. They're experimenting. Oh shit, no, not like this. Okay, I will come back later. This is the recipe I will use in my restaurant. You know how they are. Have you ever experienced chefs or to be chefs or bakers? How they go mad? Just I'm not saying, but figure out what can you do? How can you help people? Are there things in your organization, in and around your community that will help you connect?
Mm.
Maybe in and around your whatever social media platform. So LinkedIn for me is not social media. It is a marketplace. I dress up every day and come. Today, what will I wear for that photo? And my team will like, okay, you have not worn pink. You can wear pink. Like, excellent. Like you have to, and believe me, I'm not a social media person. If you have seen my life pre 2020, you will know what I mean. So it is just like, it is okay. You will create a lead by doing
Mm.
that. So just
Mm.
start somewhere. Start.
Put
Just start.
yourself out there. I
Just
see a
start.
consistency in your messaging from beginning to end. Put yourself out there.
Been
I'm
very difficult. So that's like the
absolutely.
biggest learning here.
We are at 7 o'clock, and thank you for all your questions and joining us. I want to wrap today up by saying I think the mindset of an entrepreneur is a very simple thing. When you get up in the morning, do you think of something which can be done better? Something you're doing which you can do better, or something you want to create which can be done better? So as long as we are constantly thinking about something which can be done better, and we have ideas for how to do it, and then we get down and we do it, we actually do it. Because when we are in that space of doing is when everything grows. So first, keep looking around you. What is the problem you want to solve? That is definitely an entrepreneurial mindset. and then figure out, like all our esteemed panelists have been repeating, what are your core strengths? What are the capabilities you have built over a period of time? What is coming easily, naturally for you? And how do you want to take that out to help other people? And then do it. The final thing I keep hearing from people is just go do it. And I'm telling you that I think for a long time, from 92 to 2002, when people ask me, how are you doing this? Because I just went out and did something drastically different from a traditional career track, and I was doing very well in my career, and people are like, this is not the time to do this. But that was exactly what I needed to do, and I had only one mantra then: just do it. Just do it. If you decide to do it, go out and do it. Don't think too much about it, and everything will grow, evolve, and reflective practice, like Feroza was saying. Take time to think. We are all very intelligent, smart people, so we know how to think. So reflective practice really adds value. Good luck with all of your businesses. I hope coaching helps you prosper. And if you're doing some other business, we would love to hear from you. Thank you for joining us.
Yeah.
Thank you, Bhavna,
Thank you so
Feroza,
much.
Rama. It has been a lovely conversation. Thank you
Thank
so
you,
much.
Thanks a
Usha.
lot. Great
Thank you.
insights.
Thanks,
Thank you,
Rama.
Usha. Thank you. Bye-bye.